You're watching Eye on Africa. I'm James Creedon. These are our headlines from across the continent this evening. COVID-19 continues to hit South Africa worse than any other country on the continent. The mining industry and healthcare sector are particularly affected. We'll bring you reports from our correspondents on the ground. And healthcare providers in Sudan have reported shortages of basic medications in pharmacies and hospitals. This in the context of major economic problems in the country after Omar al-Bashir's ouster last year. We'll bring you more on that. And we'll take a look at efforts in Ivory Coast to clamp down on illegal fishing and drug trafficking. The French Navy is providing assistance in those efforts. More on that story later on in the show. Thank you for watching. Now, we start in South Africa, where cases of COVID-19 continue to rise, putting it at odds with many countries on the continent that have been spared high rates of infection. Now, there have been more than 111,000 cases and over 2,200 fatalities since the beginning of the pandemic. The mining industry is particularly affected. 1,800 cases have been logged, leading to 6 deaths. And medical professionals are also badly hit, in particular in the Western Cape province. Our correspondents in South Africa sent us this report.
South African nurses are angry. They're demanding more personal protective equipment. In the Western Cape, which accounts for half the country's coronavirus cases, healthcare workers are simply exhausted.
We work more than normal hours. We were supposed to work 2 days and get off. Now we can work 5 days and more. We only have 3 nurses in the COVID side, where we're supposed to have plus minus 8 nurses.
Many nurses are living in fear. Nearly a third of them do not show up to work, a striking figure when the government is rapidly increasing the number of beds available to deal with the pandemic. In Cape Town, the International Convention Centre was requisitioned for this purpose. With more than 800 beds, it's the biggest COVID hospital in Africa. The physical infrastructure is ready, but the president himself admits that more healthcare workers are needed.
And I've said that we need to employ more health workers, bring them in, and the community screening must carry on. The testing must also be upgraded.
Nursing unions agree with this statement, but with more than 5,000 new infections every day, they are still concerned.
I'm very much worried because the department indicated that they are going to ask of other provinces, the nurses from other provinces to come and help out here. As the NOSA, we're concerned about that approach, because when we've been saying there's a shortage of nurses, nobody took notice of us. Now suddenly we'll take from other provinces. And if they then would need the nurses to be with them, then they must go back. Then we still sit with a shortage.
27 healthcare professionals in the Western Cape have died from coronavirus. With each death, the risk to patients increases ever so slightly.
Efforts to assist Sudan's political transition to the post-Omar al-Bashir era received a welcome boost on Thursday. The autocrat was ousted last year, and at a conference hosted by Germany, Western countries donated over 800 million euros to Sudan's transition. An economic crisis followed Bashir's departure from power. France, for its part, contributed 100 million euros to the efforts. Let's take a listen to the UN Secretary-General Antonio Guterres.
We need to mobilize massive political support of the international community to Sudan, to the democratic transition in Sudan, to the implementation of the constitutional declaration, but we need to mobilize massive financial support to Sudan at the present moment. And it's not a matter of generosity, it's a matter of enlightened self-interest. It's not only because the Sudanese people deserve it, it's because the world needs a stable Sudan, a democratic Sudan. It is a factor of democracy and stability in Africa and in the broader Middle East.
Now, as the country battles mounting cases of coronavirus, healthcare providers in Sudan have reported shortages of basic medications in pharmacies and hospitals, and patients suffering from critical diseases are struggling to find drugs. The country's economic woes are largely blamed on the policies of Omar al-Bashir. Maud Julien has more.
Medicine has become a real challenge in Sudan, with some patients trying every pharmacy in the capital, only to return home empty-handed.
ثلاثة يوم الليلة يا دوب الليلة لما لي في صدفة في الدواء دي وباقي لي 2 هسي ما قدرت ألم فيه ولا هسي باحث فيه وش يعني في أصم شديد وفي معاناة شديد في البحث عن الدواء. أنا اليوم قاعد من أقصى أم درمان
The country's economy has been shrinking since the independence of petrol-rich South Sudan in 2011, and the pharmaceutical sector is starting to feel the pressure. In 2019, a UN report found that Sudan's medicine imports were 20% lower compared to 2017. Pharmacy owner Abdulaziz Othman is considering closing shop.
تعادمت كل الأدوية الأساسية وحتى المتبقي يعني ماشي في النقطان يعني عدديا كل ما يمر يوم بيكون يا في صنف انتهى يا الصنف اللي بعده حيكون منتهي.
Some health practitioners have set up a center in northern Khartoum to treat patients and offer limited medication, with volunteers doing the best they can to comply with COVID-related sanitary measures.
بيتم توزيع كمامات مجانية للناس الداخلين يعني لو الزول احنا أساساً عندنا هنا في المقر من الأول لما جينا استلمنا المقر احنا بنخد معقمات بتاعت أيدي عبوات بتاعت 60 ملي ده ب 30 جنيه.
They're asking people with surplus medicines to bring them to the center to help others. Last week, dozens of pharmacists took part in a protest, urging the country's prime minister, who came to power after a popular uprising last year, to make funds available to import medicine.
Time now for some other news stories from across the continent. Senegal's President Macky Sall has begun a preventative 2-week quarantine after coming into contact with a coronavirus case. Sall did test negative, but is still taking the precautionary measures. The West African country has reported more than 6,100 COVID-19 infections and 93 deaths. And a state of emergency in place since March is being slowly lifted. DR Congo has announced the eradication of Ebola in the east of the country. Now, for an outbreak to be officially over, there have to be no new cases for 42 days. That's twice the incubation period. This most recent outbreak of the deadly disease began 2 years ago in the east of DR Congo. It went on to claim over 2,000 lives. Zimbabwe on Wednesday announced a 150% rise in the price of fuel. The country has been facing fuel shortages since October 2018. This latest spike in prices follows the launch of a foreign exchange auction system. That new system eroded the value of the Zimbabwean dollar. The central bank reintroduced so-called Forex auctioning earlier this week as it battles to stabilise the currency and fight hyperinflation. Now, for decades, the French Navy has worked with naval services in several West African countries. Their objective is to strengthen efforts to clamp down on illegal fishing, drug trafficking, piracy and other maritime security issues. Now, joint patrols are a regular occurrence, and France 24 has gained access to one ship departing from Abidjan. Thais Brook and Sam Brad Peace have more.
Setting sail from the hustle and bustle of the city, the Aviso Commandant Bouin will be gone for 36 hours. This French battleship is to patrol the waters with an Ivorian one, the Sekongo. Their mission? To crack down on illegal fishing.
Les marines riveraines qui ont des moyens de patrouille et des moyens hauturiers sortent en mer avec les bâtiments français et conduisent eux-mêmes leur contrôle de police des pêches. Et donc la Marine nationale les accompagne à ce titre-là, à des fins de formation, mais également à des fins de couverture radar.
Teams take turns on the bridge of the ship around the clock. A Gabonese officer is on board for training purposes. A trawler with a Chinese flag is spotted.
FC Congo va aller contrôler le bateau de pêche qui est à côté, donc nous on va juste les appuyer.
The Ivorian battleship sends its Zodiac towards the trawler, finding that everything is in order. The Chinese ship has a license. A French surveillance jet, the Falcon 50, was also deployed as part of the wider mission.
On continue la mission de surveillance des pêches sans le Falcon qui a été engagé hier sur une action de piraterie au large de Cotonou.
In 2019, piracy increased by 50% in the Gulf of Guinea. The attack near Cotonou was too far offshore for the Commandant Bouin to intervene. The French forces adhere to a mandate given by the West African navies.
Cette opération est très importante pour nous, la Marine nationale ivoirienne, en ce sens qu'elle nous permet d'avoir déjà un soutien logistique important et également un soutien, disons un appui en renseignement opérationnel avec le survol du Falcon.
As the mission draws to a close, the Aviso Commandant Bouin heads towards Senegal, crossing paths with another French warship on the way. In the Gulf of Guinea, the French Navy always has a ship available to protect French interests in the region.
All right, that brings us to the end of this edition of Eye on Africa. Thank you for watching and good night.